What's going on, everyone? Welcome back to my channel. In today's video, we're going to be looking at 4 exercises for degenerative disc disease in the low back. So if you've been diagnosed with this issue and maybe you have pain in your low back or pain that travels down one leg, then you're going to want to stay tuned for today's exercises. So when we think about this condition of degenerative disc disease, this can happen anywhere throughout our spine. It's most common in the low back and the neck, so the lumbar spine, the cervical spine. Essentially what happens is that the discs in between each of the vertebral bones, you can see here on the model, these discs degenerate. Basically they shrink and lose height. And when that happens, it can cause back pain and it could compress the nerve roots that exit on either side of the spine. So essentially if we lose disc height, it narrows, it closes down this space right here called the intervertebral foramen, which is where the nerve root exits. So again, people can have isolated back pain with degenerative disc disease, or they can have nerve pain that travels down one leg. The really important thing to know about this, though, is that a lot of people have degenerative disc disease and don't have pain. It's a kind of a natural process of aging. So if you see that mentioned maybe on an x-ray or an MRI, try not to freak out about it. Sometimes it doesn't cause pain. In the cases where it does cause pain, it usually gets better with rehab exercises, and I'm going to show 4 of them that often help in the patients I see. There are quite a few exercises that can help with pain associated with degenerative disc disease. I'm going to again cover 4 that tend to help, but there's a ton out there, so you just have to kind of experiment with these and see what helps you the most. Usually exercises that improve hip mobility, low back mobility, and then build strength in the muscles around the low back and hip are what help most people. So for this first one, we're going to look at a mobility exercise for the low back. This is just a gentle kind of rotational rocker type of exercise. So what you're going to do is lie on your back. You're going to have your hands down at your sides and your feet together, and you're going to move your knees from side to side, just going as far as you can comfortably, not pushing into pain, just going back and forth and looking at doing somewhere between 10 to 20 repetitions on each side. And this is an exercise that you could do multiple times throughout the day, anywhere from 3 to 5 times throughout the day. We know with degenerative disc disease that when people move more frequently, they tend to feel better. When they're really static, sitting in one spot or standing in one spot, that's when their pain tends to increase. So you just want to think about moving frequently throughout the day, doing the exercises in this video, even just going for a walk. Just try to keep your low back moving. That's one of the best things you can do to help reduce pain. Okay, so this is our first one, a rotational rocker exercise for the lumbar spine. The second exercise will be another mobility exercise. We're going to be moving through flexion and extension this time with these. This is the cat-camel exercise. You're going to go on all fours and you're going to try to isolate movement to your low back. So you're going to tuck your pelvis under, kind of tuck your tail under into posterior pelvic tilt. That's going to round the low back. And then we're going to arch the low back and move into anterior pelvic tilt. So again, just move as far as you can comfortably. Don't push into pain with any of these exercises. Just go right to that barrier and back around. Really, the idea is to work on improving mobility, which can stimulate those discs and the nerves that innervate the discs and the nerve roots and help to reduce pain and improve mobility. So again, work back and forth, somewhere between 10 to 20 repetitions. And again, think about doing this somewhere between 3 to 5 times throughout the day. Okay, so that's our second one, looking at flexion and extension mobility in the low back. As I mentioned, some people do have nerve pain when they have degenerative disc disease. I'm not going to cover a nerve mobilization in this video. I have a bunch of other videos on that. I will put a link down in the description and a link at the end of this video. If you do have nerve pain, that video will show you other exercises you can do. For this next one, you're going to use a loop band. You can get these on Amazon. There's different colors with different resistances. I'll also put a link in the description for a set of these if you want some. You're going to put this band up around your knees, both feet through around your knees, and then you're going to lie down your back again, hands down at your sides. We're going to do a bridge here. A lot of people know of the bridge exercise. It's great for strengthening the glutes and low back muscles. The nice thing with the band is we're going to push out into hip external rotation and abduction. We're going to stretch the band, which is going to help fire our glutes, and then we're going to do a bridge from there. So going up and down nice and slow, keeping that band on tension. Again, we know with degenerative disc disease that if we strengthen the hip muscles, especially the glutes, and the core muscles, it tends to help people's pain. Not only does it make them stronger, but it also can help with pain. So keep that band out there on tension, squeezing those glute muscles, pushing out into the band, and then also squeezing them as you lift up into the bridge. If this gets to where it's really easy, then you can just take the band off and switch to a single leg bridge. So I just pull the band off, straighten one leg out, and then just do a single leg bridge. The single leg bridge is really one of my favorite exercises and definitely more challenging than the double leg. So you could do a set of 10 or 15 on one leg and then just switch over and get the other leg. So start with double leg and then progress to single leg if you need more challenge. Before we get into the last exercise, I just really want to mention that my book can be a helpful resource no matter what you're going through with this issue of degenerative disc disease. As I mentioned, this video just has 4 exercises. There could be a bunch of others that we would prescribe depending on the person's unique symptoms. So you really have to test things for yourself and see what works best. The low back pain program in my book is really going to be much more comprehensive in terms of teaching you the exercises that tend to help people with back pain. So it's going to have 3 phases, pictures of me doing the exercises, and really walk you through the mobility exercises, stretches, and strengthening exercises that we would prescribe to someone with back pain and degenerative disc disease. As you can see, the program is much more comprehensive, much more than the 4 exercises I'm showing in today's video. It's a great place for you to get in there and test different exercises to see what helps reduce your symptoms the most. And each body region has its own chapter. So if you'd like to learn more about the book, I'll put an Amazon link down in the description. The last exercise is technically kind of another strengthening exercise, but it will involve quite a bit of mobility. This one's called the bird dog and is going to target our back extensor muscles. For this one, you're going to go on all fours like we were before. You're going to kind of tighten your core muscles, tuck your chin in, and then you're going to raise one arm and the opposite leg, trying to kind of keep your back in a fairly neutral position, try not to arch too much. So reach out with that arm and leg, hold for a second, and then come back down. And you're just going to alternate back and forth, moving nice and slow with control. And again, thinking about 10 to 20 repetitions. This is a nice one because it's going to work a lot on hip mobility, hip and shoulder mobility, but it also, because of the opposite arm and leg, requires that your core muscles contract and stabilize. So it's a good kind of strengthening one, but also doesn't apply a lot of stress to the low back. So it's a good one to start with if your symptoms are more acute and you're having a fair bit of pain. Okay, so those are 4 exercises that I've used with patients over the years who have degenerative disc disease in their low back. They tend to be pretty helpful for improving mobility, strength, and reducing pain. If you have any questions, put them down in the comments section, and I will see you in the next video. All right, see you guys. Bye.